All right, welcome. My name is Daniel Stillwell. I am the editor for the IFTA e-newsletter, and today we have with us Dr. Debbie Manigat. Welcome. Before we get into your work, I'd like to always ask my interviewees, what kind of mental health practitioner or therapist do you identify as, and what does that look like where you are?
Well, thank you for having me today. I bring you greetings and some sunshine from South Florida. I'm a graduate of the Nova Southeastern University, Dr. Karan C. Patel College of Osteopathic Medicine, and that was for my doctorate in marriage and family therapy.
Nice.
And so my focus is on using satir, transformational systemic therapy, and narrative therapy for developing the capacity of the child from birth through age 5, but also the adult in terms of healing adverse childhood experiences so that they can experience and regulate, express emotions, form those close relationships if they seek to, and get an opportunity to explore their environment and learn all in the context of family, community, and the cultural experiences that are important to them.
Very nice. So when you work with clients, what does that look like?
Sure. When I work with clients, what I love about family therapy is it's not necessarily about the tools and techniques, but really it's about your way of being and the relationships that you build, that therapeutic alliance, and really giving them an opportunity to share what their meaning making is. And really, that's the beauty of narrative therapy, that you get to bear witness to them learning about themselves, creating a new narrative, and determining where does their life go from here.
Excellent. Well, speaking of the life process, a lot of your work is in birth equity. What does that mean, and what kind of either research or work are you actually involved in?
Sure. That is my passion area in terms of research. And I try to influence everyone to join me and become an infant mental health specialist. But in my journey, I've been afforded the opportunity to grow in this area as a doctoral fellow with the American Association of Marriage and Family Therapy through their Minority Fellowship Program, but
Wonderful.
also in the inaugural mindfulness community of practice through 0 to 3, which is a national organization focused on early childhood, infant mental health, and maternal mental health. So I'd like to share 5 of those projects really briefly.
Okay.
2020, as we know, was quite a time for all therapists around the globe dealing with COVID and then ongoing with 2021. So I really had to pivot my practice not only to telehealth, but also thinking through how do you create a space that is authentic? How do you create therapeutic healing that is really meaningful and impactful to the families that you serve? And how do you do research also in this new space? So my doctoral project explored a narrative systemic review of articles that were organized by the family life cycle on how family therapists with an infant mental health lens can be very influential within a whole life view for maternal and infant mental health care. Some research that I did with the March of Dimes showed that prolonged exposure to high levels of stress can cause health problems such as high blood pressure or heart disease, and may also increase the chances of having a premature baby. Yet this is not a new phenomenon. In the 1960s and 1970s, Satir actually notes in her observations and communication stances how mental health patterns can impact physiology and manifest somatic outcomes. Moreover, in many cases, when you think about that time period of maternal journey, getting ready for parenting, getting ready for birth, there's a lot of stigma associated. And actually, it keeps pregnant women from seeking therapy because there's this like added sense of shame and thinking, well, this is just supposed to be, the happiest time in their life. However, there can be emotional distress if they're going through infertility, if they experience a miscarriage, or even infant mortality, as well as many other birth concerns, not just for the woman, but also for the male or the father involved. So my research informs family therapists where they can be present for grief care if they lose the baby, or unfortunately, if the father loses the mother, counseling for depression that comes along with that, and even post-family planning for preconception care when the family is ready to determine how they want to continue reproductive care. Do they want to have other children, and what does that look like in honoring the children that they may have lost or the experience that they went through?
Yes, and when I hear about equity, I also think about power dynamics and infrastructure, and here in the States, we are currently discussing and having a debate about the role of abortion and forced birth and all sorts of different dynamics. Our audience is international, though. So how do you see some of this applying to people throughout the world?
Okay, thank you for that question. And I think you really framed it very well. Our country is really thinking through learning actually from the international community as it concerns infant mortality and maternal health. In
Hmm.
fact, our Vice President, Kamala Harris, uh, is starting a maternal health initiative. They just had a conference at the White House to bring attention to this matter because they recognize that the US is doing very poor in this area. And for me, what does that mean is that we're losing a lot of lives due to
Hmm.
infant mortality, due to maternal mortality. And in my minority fellowship program, I entitled it Shifting Perspectives, Disaggregating Data by Race and Infant Mortality and the Rise of Family Therapy in Infant Mental Health. Because I think for the international community, that is where we will serve best by bringing family therapy to OBGYNs, to pediatricians, to nurses who are involved in maternal mental health, bring our systemic lens, bring our strength base, our relational way of being, in order to really help those systems that are serving directly with those families in need of support, of opportunities to reflect, to release. And what was interesting in my quantitative analysis and disaggregating the data by race living in the United States, I learned that we have such a time to look at how do we change health disparities, especially regarding Black or African American mothers whose infant mortality rate is the highest.
Hmm.
So it even is larger than thinking about just infant mortality, but also how do we build capacity for us to serve mothers who may be struggling with substance abuse or opiate misuse in pregnancy. So in my journey of doing all of these several projects, I learned that we have such a mission and such a call to action to recognize that pregnancy-related deaths, whether it is the child or the mother, disaggregating by race and recognizing the disproportionate high rates of maternal mortality and morbidity, gives us as family therapists a chance to come in and give them a safe space for processing, for healing, for recognizing other resources as well in the community that may be able to help them.
Wonderful. Yes, I think it is so important to recognize that different cultures, different countries, different institutions can collaborate, learn from each other, because we're all in this together,
Right.
and playing our different roles. One last question. We'll keep this short since we don't have much time.
Okay.
What does your work in soul care look like? Because that's also something that you have a passion for.
Right. So on my website, you will find iGuide. So it's an inspirational guide called Thrive, looking at the body, mind, and spirit, taking through that satir approach again of how do we look at a person holistically? How do we recognize what is going on in their mind and their behaviors, in their body, somatically, but also thinking through the other side that sometimes therapists may not be comfortable in exploring, especially if they are not necessarily trained in that area. So for soul care, you're getting an opportunity to explore different faiths. You're getting an opportunity to explore what I like to call inner work or heart work, to really give the clients an opportunity to determine what is important for their healing, what is important to include in the therapy room for their culture, for their faith practice. And when you download the kit, you're able to also hear from various mental health professionals and faith leaders from around the world, actually, sharing what are some things that we can do clinically to help families, to help church leaders, to help other therapists focus on suicide prevention and substance abuse. So I'm so excited that you're giving this space and this opportunity for us to recognize that just us as human beings, we are so complex. We have so many layers to ourselves. And the more training that we can get as therapists to fully support the clients that we serve in our journey, it's not just better for the client, as we say best practice, but it's also better for us in our growing and refining what is the way that we would like to really show this therapy we make together.
Wonderful. Yes. Well, your systemic training is very evident, thinking about the whole person, not only in the lifespan, focusing on birth equity, but also the biopsychosocial, spiritual lens of it all. So thank you very much for being part of us. This is Dr. Debbie Manigat, and I'm Daniel Stillwell. Thank you very much.
Thank you. Thank you. I appreciate being here.